aming tubig. Buhay ng pamilya natin na nakasalalay dito. Let's give us one.
Magandang hapon po sa inyong lahat. Narito po tayo muli sa ating Beat COVID-19 Virtual Presser upang ihatid sa inyo ang mga updates sa mga inisyatiba at pakikipagtulungan ng kagawaran sa iba't ibang ahensya ng pamahalaan at sa pribadong sektor sa pagsugpo ng COVID-19. Ang ating pagpapatupad at pagsunod sa enhanced community quarantine sa iba't ibang lugar sa ating bansa ay napatunayan nating epektibo upang ang gobyerno at ang private sector ay makapaghanda at mapahusay ang ating mga kapasidad na labanan ng pandemya na ating hinaharap. Bahagi ng ating strategy ay ang pag-ramp up o pagpapalawig sa ating testing capacity at pagpapadami ng ating quarantine facilities hindi lang sa Metro Manila kundi sa ibang probinsya. Kaya naman malugod naming ibinabalita sa inyo na nung Sabado ay binuksan natin ang Molecular and Diagnostic Pathology Laboratory sa JB Lingad Memorial General Hospital sa San Fernando, Pampanga. Ito ay isang state-of-the-art laboratory na pinondohan ng Asian Development Bank. Ang pagbubukas ng nasabing laboratorio ay isang malaking hakbang tungo sa ating new normal sapagkat ang laboratory na ito ay makakadagdag sa atin ng 3,000 tests kada araw sa ating national daily testing capacity. Ang nasabing laboratorio ay makakatulong sa ating sinasagawang mga pag-aaral sa mga genetic diseases, cancer, at iba pang microorganisms na nagdudulot ng sakit pagkatapos ng pandemya na ito. Ngayong hapon po ay kasama natin si Mr. Kelly Bird, ang Country Director ng Philippine Country Office, Southeast Asian Department ng Asian Development Bank, upang pag-usapan ang ating bagong tayong Molecular and Diagnostic Pathology Laboratory sa JB Lingad Memorial General Hospital. Siya po ay naging Country Director noong 2018 at dala po niya ang higit sa 10 taon na karanasan sa iba't ibang bansa sa Asia sa regulatory governance and reforms, financial sector development, trade and investment policy at marami pa pong iba. Mr. Kelly Bird, good afternoon. Thank you for taking the time to be with us today. Okay, I will be going straight to our questions already. Mr. Bird, is that okay with you? Yes, our first question would be, what made ADB decide to give this grant and what is their vision for this facility? Okay, Mr. Bird, I think really that was fast. As far as we are informed, the machines just came 2 weeks ago and the laboratory was established very fast. So, Mr. Bird, if you may be able to help us be enlightened, how this facility will help DoH with our targets for testing. Mr. Bird?
Oh, sorry, I lost you there. Could you repeat the question, please?
Yes. We were asking if how this facility will help DoH with its targets for testing.
Okay, well, definitely. You know, as you know, the Department of Health's target is 30,000 tests per day by the end of the month. This lab has capacity of about 3,000 tests per day. So it's now up and running, and we expect it to be at its full capacity within the month. So it will have a big contribution towards helping the Department of Health meet its 30,000 tests per day target.
That's great. The 3,000 tests per day that JB Lingad will be contributing will be of great help to the cause and the objectives of the department into reaching this 30,000 tests by the end of May. So we have heard that this laboratory can still do other things aside from testing for COVID-19. Is that right, Mr. Bird?
Yes, this lab will be a permanent lab at the Jose Lingard Hospital. So it will continue to test, samples beyond this pandemic. But, the hospital is also a teaching hospital, so it makes a lot of sense for this lab to be a research lab. So it will also serve to research on other viruses, genetic diseases, and also research into cancer. So it does play a very important role in the hospital's teaching component going forward, in the long term.
So this is really important, Mr. Bird, that it is not just supposed to be a COVID testing laboratory for the Philippines, but also after the pandemic, it will still serve some other purpose for the Philippine healthcare system. And this is something very important because it's going to study on other diseases aside from these emerging infectious diseases in the country. Among the different areas in the country, Mr. Bird, why did you choose Pampanga to be the location of this huge laboratory?
Well, of course, we took our guidance from the Department of Health, but there were 3 or 4 reasons why we were very keen on setting up the lab at the Jose Lingard Hospital in San Fernando City. The first one, of course, is at the time, Region 3 had the second highest number of confirmed cases. And so clearly a lab was needed to serve Pampanga and the surrounding region. The second reason is that the hospital is a high-quality public hospital. It's got over 250 beds. It's a teaching hospital. So we considered this hospital to have the capacity to quickly scale up testing. Finally, over the long term, it's important to have, this hospital will be important to Pampanga and the region, and it's always important to expand its facilities. So including a state-of-the-art lab, it's going to better serve the population in Pampanga. I also have a personal reason why I was happy to see this hospital get the lab. Over the past, we've had a number of projects in San Fernando City. I very much like the city. I've always had pleasant experiences there. We have a number of projects like our youth employment program. We're also doing a lot of infrastructure projects like our Malolos Railway project. And so I think it was just a lot of satisfaction to see that we're also able to help the region in the health sector.
That's great. Very much agree with you, Mr. Bird. Region 3 is one of the bigger regions here in the country. And currently, with the COVID-19 cases, we also are having increased number of cases in this area. So I think Pampanga is a very appropriate location for this huge laboratory. So can I ask if ADB is still looking at other facilities or still looking at, or are there any plans of building this kind of facilities in the other areas of the country in the future?
Yes, absolutely. We're discussing with the Department of Health right now a $125 million project to scale up the health response against COVID. We hope that this project will be approved next month. It will include 2 new labs, and these labs will be state-of-the-art biosafety and biosecurity standards. The project will also include training the lab technicians in the use of the equipment, and they should be, again, we hope that they'll be up and running fairly quickly. But this project, this $125 million project, not only includes those 2 labs, but it also includes scaling up testing kits, equipment, supplies that will be distributed to other public hospitals. It will also include renovating and constructing new isolation wards at selected public hospitals. So it will be quite a comprehensive project supporting the Department of Health scaling up its response.
I think this is great news for the Department of Health as well as the whole of government of the Philippines and of course our citizens here in the country, because with what you have said as to your plans of building additional facilities like this and helping with our isolation facilities, this will contribute more to the objectives of our department in our response to COVID-19. So as we all know that the facility has already been licensed, when do you think that it will start its operations?
On Saturday, I joined my Vice President, Ahmed Sayed, and also my colleague, Gerard Tavat, to join the launching of the lab. That day, Secretary Duque announced that the lab received its license. It's now been fully accredited, so it can start business. And we've provided all the training. The lab is now staffed with well-qualified trained technicians. So we would expect that the lab should be running at full capacity of its 3,000 testings per day, running at 2 to 3 shifts by within a month.
This really is great news, Mr. Bird. So with that, any more messages, especially to the Filipino people, please?
Yes, I do have a number of messages. I think I have, say, 3 or 4. And the first one, of course, is, right at this moment, it is important to continue to support the Department of Health in scaling up testing and contact tracing to reach that 30,000 tests per day. Evidence overseas shows that those countries that have been successful have done massive testing and contact tracing. I think, over the longer term, ADB would like to continue to work with the Department of Health. This has been a great partnership. We want to continue that, and we want to work with the Department of Health to build a strong health system ready to meet the next health crisis by focusing on implementing the universal health care law. So I think that would be important in the longer term. But I have 2 other messages. First of all, I really do want to commend the Department of Health, the government of the Philippines, for its decisive actions in fighting this virus. It's taken a very comprehensive approach, scaling up its health response, fiscal programs that have helped to transfer funds to vulnerable families. And I think with this, including the enhanced quarantine that was implemented in March, all of these actions together has helped the Philippines contain the pandemic and prevented the Philippines from experiencing what we've seen in other countries. So I think, the Philippines should be very proud of that. But I also want to commend all Filipinos. Everyone has made sacrifices in the last 2 months, but it's been one big collective effort by all 108 million Filipinos. So it's truly been a team effort. So you should be very proud of what you have accomplished so far. But it's far from over. It's kind of like climbing a mountain. You've climbed, you've got to the top, you've got to the summit, you've hoisted your flag, but you've got to come down. And that slope is very slippery. it's got its risks. So there's a lot more work to be done. You've got to still keep those numbers low. You've got to prevent a second wave. But at the same time, you've got to open up the economy towards that new normal. So I think if Filipinos continue to do what you really do well, and that's working together, I think the health system and the economy will come out much stronger.
So thank you very much, Mr. Kelly Bird. Thank you for accommodating our invite for you to talk here in our virtual presser for DOH. We thank you also for your support and the partnership with ADB, which will really contribute for DOH and the whole of the Philippine government to achieve our 30,000 tests per day by the end of May. Maraming salamat, Mr. Kelly Bird, for your time. Early detection and isolation of new COVID-19 cases is critical to managing potential outbreaks, especially as the government is considering gradually lifting quarantine measures. This makes testing all the more vital, and we are grateful for ADB's support as we continue to work on strengthening the capacity of the country's healthcare system in this war against COVID-19. Thank you very much, sir. Bagamat malaking tulong ito sa ating battle plan against COVID-19, ayon na rin sa ating kalihim na si Secretary Francisco T. Duque III, marami pa tayong kailangang gawin to ensure that our health system is fully equipped to handle both the detection and treatment of COVID-19, as well as other emerging and re-emerging infectious diseases with pandemic potential. We thank our partners in the private sector who are helping us in this endeavor. We thank the Unilab Foundation, who assisted in retrofitting the hospital to meet with our biosafety standards, and the Beijing Genomics Institute, one of the world's largest genomics companies serving more than 66 countries, for providing technical support in setting up the laboratory and clinical hospitals. Malinaw sa atin na ang laban kontra COVID-19 ay kailangan ng whole-of-nation approach na may close coordination between the private sector and the civil society organizations. Ayon sa ating T3 strategy o ang test, trace, and treat, kailangan nating palawakin ang ating resources hindi lamang sa isang aspeto ng strategy na ito. We cannot focus on testing labs alone because we have to be able to do more than just know who is infected. Kaya naman, todo-todo ang pagtayo at pagproseso natin sa mga isolation center sa buong bansa. Napakalaking tulong ng Wihilas One Center sa Clark City na ilang buwan nang tumatanggap ng ating mga kababayan mula sa ibang bansa o ang ating mga OFWs bilang quarantine areas bago sila maaring makauwi sa kanilang mga pamilya. Ang pasilidad na ito ay ang second largest urban hub sa bansa. Tayo rin ay nakapag-ramp up ng isolation capacity sa Cebu City to 3,975 at inaasahan itong tumaas sa mga susunod na linggo. Sasamahan po tayo sa Miyerkules, May 13 ni BCDA President Vince Dizon na naatasan din bilang Chief Coordinator para sa T3 program upang balitaan tayo sa mga bagong testing and isolation facilities na binubuo sa iba't ibang parte ng ating bansa. As of 4 p.m. today, May 11, nakapagtala na tayo ng 292 na bagong kaso at umaabot na po ang kaso natin sa 11,086. Sa 292 na kasong ito, 162 or 56% ay mula sa National Capital Region at 74 or 25% ay galing naman sa Region 7. Meron din po tayong 75 na bagong bilang ng mga kababayan na napagtagumpayan ang laban sa COVID-19. Sa kabuuan, meron po tayong 1,999 recoveries. Kasama po sa mga naitalang nakarecover ay ang mga pasyenteng nakakonfine at mga pasyenteng may mga positive mild and asymptomatic cases na nakarecover mula sa kanilang self-isolation at home quarantine. Ngunit ikinalulungkot po namin ay balita na 7 ang nadagdag sa bilang ng mga pumanaw na sanhi ng COVID-19. Dahil dito, umabot na po sa 726 ang bilang ng mga nasasawi. Pinapaabot po namin ang aming taus-pusong pakikiramay sa lahat ng mga naulila. As of May 10, makikita po sa inyong screen na meron na po tayong 1,991 healthcare workers na nagkaroon ng COVID-19 sa ating bansa. Sa bilang na ito, nakapagtala po tayo ng 584 na healthcare workers na nag-recover mula sa COVID-19. Nitong mga nakaraang araw ay paunti na ng paunti ang nakikita natin mga healthcare workers na nagpo-positibo. Sa nasabing bilang, ang 1,373 ay active cases. Ang 584 sa mga healthcare workers ay nakarecover na at kinagagalak din po naming ibalita na kahapon ay wala tayong naitalang bagong kaso ng healthcare worker na namatay mula sa sakit na COVID-19. Ang kabuang bilang ng deaths among our healthcare workers ay nananatili sa 34. Muli, nakikiramay po kami sa mga pamilya at kaibigan ng mga yumaong bayani natin. Kami ay nalulugod din na ipakita sa susunod na graph ang patuloy na pagbaba ng mga bagong kaso ng COVID-19 sa ating mga healthcare workers magmula April 11. Makikita po dito ang pagbaba ng mga kaso ayon sa propesyon ng ating healthcare workers based sa onset of illness. Malaking tulong ang ating infection prevention and control measures na striktong pinapatupad ng ating mga ospital upang masiguro ang kaligtasan ng ating mga frontliners. Ukol naman sa kapasidad ng ating healthcare system, makikita po sa inyong screen ang number of beds in our hospitals. As of May 10, meron na po tayong 13,238 total bed capacity na dedicated sa COVID cases lamang. Sa slide din po ito ay makikita kung ilan sa mga beds na ito ay ward, isolation at ICU beds. Our daily situational report will be released today showing the latest numbers as well as initiatives and activities of the DoH in this war against COVID-19. Para naman po sa iba't ibang kagamitan at personal protective equipment o PPE na ating patuloy na ipinamimigay sa mga ospital at pasilidad sa bansa, makikita po sa inyong screens ang kabuang bilang at breakdown ng mga naipamigay natin kahapon. Sa ating testing capacity naman po, May 10 ay nakapagsagawa na ang ating laboratorio ng 8,637 tests at sa kabuuan ay nakapagsagawa na ng 173,144 tests. Ang mga test na ito ay isinagawa sa 158,176 unique individuals kung saan 142,661 o 90% ay negative, samantalang 14,981 o 10% sa mga ito ay positive. Lilinawin lang po namin na ang bilang ng mga total tested individuals ay maaring mas mataas sa official number na inilalabas sapagkat ang mga numero pong ito ay sumasailalim pa sa case verification and validation process ng DoH. Meron na rin po tayong 26 na lisensyadong laboratorio sa buong bansa na nakakapagsagawa ng RT-PCR tests. May 3 laboratorio po tayo ngayon na nasa stage 4 at 30 sa stage 3 ang ating inaantabayanan na makatulong sa ating testing capacity. Sa huling talaan natin noong May 10, ang kagawaran ay nakatanggap ng 73 facility requests para sa emergency hiring ng ating healthcare workers. Meron na po tayong 3,315 slots na na-approve for hiring para sa 59 health facilities kasama ang mga quarantine facilities. Meron tayong 1,002 na personnel ang natanggap sa 11 na ospital at quarantine facilities. Nakapag-redeploy na rin po tayo ng 749 nurses sa ilalim ng Nurses Deployment Program. 170 nurses galing sa Luzon at 579 naman po sa Visayas at sa Mindanao. Patuloy po ang ating panawagan para sa ating mga frontliners. Heto po ang mga numero para sa ating priority facilities na bukas para sa ating mga bagong bayaning healthcare workers. Hindi magtatagal at tayo'y maninibago sa sitwasyon kapag nagka-transition na tayo mula sa ECQ papunta sa GCQ. Hindi na magiging masyadong mahigpit pagdating sa paglabas-labas ng mga tao at baka marami sa atin ang magkaroon ng false sense of security dahil hindi rin natin direktang mararamdaman ang banta ng COVID-19. Nais po naming paalalahanan ng lahat na hanggat wala pang gamot o bakuna ang COVID-19, mananatili pa rin ang banta sa ating kalusugan. Mananatili pa rin ang banta para sa isang malalang outbreak. Ang COVID-19 ay isang panganib na hindi natin nakikita. Ngunit ang sakit at kamatayan na dala ng virus ay tiyak na makikita natin, tiyak na mararamdaman natin. Habang dumarami ang mga lumalabas ng bahay, pinapaalalahanan po namin ang mga kainan, mga commercial establishments. Mahalaga po ang inyong papel na gagampanan sa pagliligtas ng buhay. Kayo po ang magiging puntahan ng mga lugar sa mga susunod na panahon. Kaya't sadyain po nating ipatupad ang ating health protocol sa mga empleyado at sa mga customers natin. Ipaalala po natin sa ating mga empleyado na mag-physical distancing, magsuot ng mask, palagi ang mag-sanitize ng lugar kung saan nagtatrabaho. Sa mga employers po, bantayan po natin na manatiling malusog at walang virus sa ating mga empleyado. Siguraduhin po natin na ang lahat ng humahawak sa pagkain ay ginagawa ito ng maayos at lahat ng uri ng sakit sa ating mga food handlers ay minomonitor. Siguraduhin po na prepared tayo sa pagbibigay ng agarang medical assistance and benefits sa ating mga empleyado sakaling maging biktima sila ng pandemyang ito. Siguraduhin din na may kakayanan tayo sa madaliang contact tracing measures upang maprotektahan natin ang publiko. Sa atin namang mga kababayan, may mahalagang papel din kayong gagampanan kapag nag-transition po tayo sa GCQ. Dahil dumadami na po ang mga taong lalabas sa bahay, tumataas din ang panganib na mahawa sa COVID-19. Kung ganun po ang mangyayari, inaasahan po natin na tataas na naman ang ating mga kaso. Ngunit ngayon ay maari na nating pabagalin ang pagkakahawa-hawa upang hindi ma-overwhelm ang ating health system. Lagi po nating tatandaan na mag-physical distancing, magsuot ng face mask, palagi ang mag-ugas ng kamay at sumunod sa cough etiquette o ang tamang paraan ng pagbabahing o pag-ubo. Hindi pa po tapos ang laban ng World War C. Sa bawat bagong impormasyon, bawat bagong teknolohiyang nadidiskubre upang malabanan ng COVID-19, tayo dapat ay manatiling laging alerto dahil ang bawat ginagawa natin ay maaring may buhay na maililigtas. Ngayon po ay matutunghayan natin ang video mula sa United Nations Population Fund or UNFPA tungkol sa maternal health.
Ito ang aking bahay kasama si nanay. Parang balon, no? Lumulobo. Palaki ng palaki. Para ako po. Lobo. Magsimula ako sa maliit na maliit. Pero dahil sa love ni nanay, lumaki ako, lumaki. Look at me grow na. Ayan tuloy. Ang liit dito sa balon. Ang sikip-sikip. Sabi nung tinawag na do, malapit na daw akong lumabas. Yay! Pwede akong lumabas, nanay? Bakit parang maalog yung balon na bahay ko? Marinig ako. Boses yun ni nanay. Hinahabol ang paghinga. At si tatay.
Mukhang lalakarin na lang natin.
Ang layo! Hindi ko alam kung kaya ko pa!
Oh no! Anong magyayari kay nanay?
Barangay ho ito. Nandito na kami, Nay. Dalhin na namin kayo sa center.
At may bigla pumutok may tumatayloy. Parang ako'y magsiswimming at inaanod. Asan akong punta? Anong liwanag ngayon? May humihila sa akin.
Konting tiis na lang.
Nanganak na ako!
Nanay, ito ba ang labas?
Nay, nandito na kami para sa inyo.
Ayan na! Nanay! This is it! Ito na! Lalabas na po ako!
Paalala para sa kalusugan ng ating mga nanay. Siguraduhin po nating ligtas ang pagbubuntis at panganganak ng ating mga nanay sa panahon ng COVID-19. Para naman po sa ating mga nanay, planuhin kasama ng inyong doktor o midwife ang inyong panganganak sa birthing facility o sa ating mga ospital. Para naman po sa ating mga barangay, siguraduhin na may masasakyan ang ating mga nanay na manganganak papunta sa birthing clinic o sa mga ospital. At para naman po sa ating lokal na pamahalaan, panatilihing bukas ang ating mga birthing clinic at hospital maternity wards sa inyong mga lugar sa panahon ng COVID-19.
Ito ang aking bahay kasama si Nanay. I love you, Nanay!